Like Jess said, I'm Elizabeth Thompson. I am the Dean of the School of Allied Health Sciences at LMU. I'm a veterinarian. I'll go ahead and share my screen, just a little preview of what I'm going to be talking about next month in October. So just a little bit about what we do at LMU. We're in a unique geographical position where we can incorporate some service learning opportunities for our vet tech students and also maybe for our pre-vet students. So service learning is important at LMU. We are a university that was founded by an idea that President Lincoln had back in 1863 to reward people in this area for their loyalty with some educational opportunities. So as you can see at the bottom of all my slides, there's three little words: values, education, and service. And these are sort of the three tenets that the university is founded on. So anytime we have an opportunity to do education and do that through service learning opportunities, the university does support and encourage those efforts. This is just a recent beautiful picture of our campus, just a small snippet of the campus. If you've never been to the Tristate Area, I encourage you to visit. It is beautiful here. The Vet Tech program at LMU was founded back in 1985 and received its initial accreditation in '87. And what I'm really going to focus on today is the program's partnership with an organization called Remote Area Medical. And we started that partnership here, the university as a whole, in 2004. But the Vet Tech program, we also do work with local shelters, with rescues, with foster networks, just really anything that can connect pets and people and get pets in better living situations. So the real need that we've identified is here in our local area. Tennessee, Kentucky, and Virginia come together in what's called the Tri-State Area. And this is exactly where LMU is located. We're just on the Tennessee side of the border. And this is an area of the world, an area of the country where many of our residents live just right at or slightly above the poverty level. And disposable income is not something that people enjoy here. We've got a lot of endemic problems for veterinary care in the region. The biggest thing is there's just barriers to access to veterinary care, and that's certainly a hot topic these days within a lot of organizations, is that access to care component. And that can be broken down: financial, geographical, physical. We also have this cycle of pet overpopulation. There's not a lot of opportunities for low-cost spay-neuter, not a lot of preventive care opportunities. And most of those opportunities are income-based, and so they're set aside for individuals that live below the poverty level. So that does leave a gap for those that are just slightly above that level. We also have some very small and very overburdened county animal shelters that just need some help. So we began working with RAM, and what is RAM? This is a nonprofit. It's located in East Tennessee, and it was founded by the late Stan Brock. For any of you that are old enough to remember Stan Brock from Mutual of Omaha's Wild Kingdom, or even when he was starring in movies, he founded RAM and the principles that there's a dedication to free medical care to those in need. So this is for humans and for veterinary patients alike. And here at LMU, we've been privileged to host numerous RAM clinics over the years that have served human patients and pets. And this is a huge monumental event. So we have a large number of volunteers that come to these clinics every time that we offer them. But for the veterinary clinics, where do our vet tech students and pre-vet students and even veterinary students, now that we have a CVM, where do they fit in? And really, anywhere they would fit in a hospital, they would fit in at a RAM clinic. We operate very similarly to a hospital would work. And so we have different areas, different departments, and they can fit in virtually anywhere. What do they gain? As those of you know that teach or direct veterinary technology programs, it's very hard to translate what is done in a lab or done in a lab even with models and make that a real world experience. And so that's what these RAM clinics are. They're real world experiences. We also empower our vet tech students, whether they're a first year or a second year, to give them tasks at their level of expertise that makes them feel like a grown-up vet tech. But it's a safe environment. They get to see a good action of teamwork. These are huge events with multiple veterinarians, multiple veterinary technicians, multiple players, but we all come together and we work as a team, and they get to see that. And then they have a networking opportunity. All these volunteers come from different areas, different geographical areas. There might be veterinarians that are looking to hire graduate vet techs. They might be working with veterinary students that will remember those vet tech students when they get out and get a practice and reconnect. So it's always a good opportunity to put these two groups together. You got to inspire students to volunteer, and it seems like more and more that becomes more difficult. Not because students are bad, not because this generation is bad. It's because they have things going on in their lives that we don't know. So got to be respectful of their time and their lives. So it's not something that you want it to be mandatory. If it's mandatory, it's not volunteer. And to not judge those that don't volunteer or can't volunteer. Some want to and just simply can't. Try to make that volunteering easy. Be flexible with the scheduling. Our RAM clinics work from anywhere from 4 a.m. to 7 p.m. So not everyone needs to have that schedule. That's generally my schedule. And try to pair their assignment with their strengths. So if you have a student that is really super talented with restraint or super talented with venipuncture, put them where they get to do those things that they're going to feel confident doing. And then make it mean something. I've found that if you give them a responsibility for something, even if it's small, they get an immense sense of satisfaction. They get a sense of pride. And if you can put them in contact with owners, when owners come to pick up, or if owners just stop by and have a question, if you can put those vet tech students in contact, it's a great way for them to practice those soft skills that we all struggle to teach in our classes. So what do we do at these RAM clinics? It's a little bit of everything, it seems like. The primary goal is spay-neuter. We want to reduce pet overpopulation. We want to prevent diseases that can occur when animals are not spayed and neutered. But we also provide vaccinations, so everyone gets a rabies shot, and dogs get a distemper parvo booster, cats get FVRCP. Do those little things that vet techs and veterinarians love to do when animals are asleep. So we clean ears and we trim nails. We address fleas and ticks. We address intestinal parasites. We will address, simple infections, just simple little things that we can make a big impact on that day, we'll handle. So I wanted to take you through the most 3 recent RAM clinics that we've done. Of course, COVID has impacted what we wanted to do this year and we're not going to be able to do. So wanted to go back to the most recent 3. So in 2018, we had a RAM clinic, and at the same time, LMU had a human RAM clinic. So it was held over in Tex Turner Arena, which is our basketball arena here on campus. Luckily, the building that we do the RAM clinic in shares a parking lot. So this clinic, over 2 days, we treated 106 pets and estimate the value of care for the services we provided somewhere in the vicinity of $30,000. So I've just got some pictures of some volunteers. This time what we did is we checked our patients in over in front of the arena, loaded them up in our program's van, and then just drove them across the parking lot, unloaded them over here in front of our building to do check-ins. We also had a great volunteer organization called Red Rover. They're based out of California. If anyone ever has the opportunity to work with Red Rover, they are a fantastic organization. They primarily do disaster relief, but these are individuals that are trained to work with animals, not necessarily vet techs or veterinarians, but they do have training to deal with animals, especially in disaster situations. So they're wonderful folks. We had some faculty from the College of Veterinary Medicine that came and lended a hand doing some physical exams. 2019, we did a repeat. We did the first weekend in June. And at that clinic, we treated 107 pets and for us, and she just recently left us. The lady with her is Amanda Weber, who is in charge of veterinary services for RAM, and so we work closely with Amanda when we're planning clinics. This is one of our CVM students. She came and worked a few RAM clinics with me. She's about to graduate. She was a tremendous student. These were some, at the time, rising second-year students. They have since graduated, but these three young ladies single-handedly manned the cat room and handled all of the cat examinations, all of the ornery cats. They handled it all. They didn't need help, and they did a great job. This is a former veterinary student. She graduated in 2018. And was a friend of the program the whole time she was in school. And so she said she would love to come back and do some surgery, and she did. So we appreciate Dr. Kayla Meehan coming. These are two former students. Not only do we have students that are involved, we have graduates. We have alumni that come back because they just want to come and they just want to help out. We also did a little bit of a survey afterwards where we're developing an access to veterinary care survey with our CVM colleagues, and so we did collect some data afterwards. And again, our Red Rover volunteers, we could not have made it without them. They were tremendous. Our most recent and most surprising venture was a February 15th feline only clinic that we held in early 2020. I really expected that we would see somewhere around 75 cats. On that one day, we saw 128 cats, and I had to turn away 60 because we just physically ran out of time and supplies and people. But we did take those 60 in on 2 additional days, and so we did a total of 188 cats. Estimated value of care of $35,800 just in cats. I had no idea there were this many cats in need. So again, we've got our students. These are some students that really have a passion for shelter medicine, for high volume medicine, and love cats. This is actually a picture of some veterinary students, some pre-vet students, and some vet tech students. So we had these 3 groups of students that came together and worked just like a well-oiled team. This room, this is one of my veterinary technicians here in the program, Bethany, and she was in charge of the anesthesia drugs. Bless her heart, she sat in this chair all day long and didn't move. But she was the keeper of the controlled substances and the recording and did a fantastic job. And this is just a small glimpse. This is our classroom that was dismantled and turned into a combination anesthesia and recovery room. And the bulk of those 128 cats are probably in that room right there. I actually did some surgery. This is me. And one of our second-year students at the time, she has since graduated as well. And this is our program director here on the left, Dr. Bachtow, doing surgery. And we have a anesthesiologist from the veterinary school, Dr. Ebner. She likes to come and help out where she can. So we like to put her doing anesthesia. And what you can't see because there's a fluid bag in front of his face, that's one of our veterinarians, Dr. Jay Miles. He's doing some surgery, and as you can see, there's ample opportunities for students to get involved and students to watch what is happening and learn. And then recovery, where everyone just sits on the floor and tries to warm kitties and wake them up. So these clinics are not for everyone, and you have to have the perfect storm of a community that needs help, a university that's supportive, and a good partner like RAM. So I'm sure a lot of people are thinking, how in the world do they pay for them? Vet tech programs are not known for their ability to spend a lot of money. Well, RAM does cover or reimburse for a lot of the costs. We get donations from vendors. We work with all of our vendors. We work with Covetrus, we work with BI, and they're all happy to help out and donate maybe some vaccines, maybe some dewormer, maybe some antibiotics, distributors as well. We are fortunate here that we have a medical supply company here locally, Doroil Industries, and they're always good to donate things like surgical drapes, gauze, all those little things that once you start buying a lot of them, they add up. And then the university. The university is supportive of these service projects, and particularly anything that we can do to benefit our local community and involve students and educate students at the same time. So the university does allow some pretty good budgetary support. I've never had any problem with spending any money that we may have, just so long as we know that it is some sort of educational opportunity for the students. As many of you, I'm sure, have experienced, COVID derailed everything. So our plan after the February clinic was a 2-day clinic for dogs and cats. We were going to do that the first weekend in June. That didn't happen. And for now, we don't know what our plans are. We're not doing anything here on campus for the remainder of this year. My personal long-term plan is I would like to get a standing rotation of quarterly 1-day clinics with a firm cap on numbers of animals, so that there's less disruption for individual schedules. Trust me, a 2-day event is hard. We don't need as many volunteers if we're not doing as many animals. And with spaced out frequent clinics, that would give more opportunities for students to volunteer, would be friendlier for their schedules. I can maybe ask off from work or things like that. So that's our hope for the future. Recently, though, some faculty at our CVM was awarded a PetSmart Access to Veterinary Care grant, and because of COVID, actually has 2 years to carry that out. So we're hoping to do some spay-neuter work here with the Vet Tech program, do some things in the community, maybe with some vaccines, just some community education. So that's our next big thing that we plan to get going with. But what makes this important? Why is service learning important, and why is it important for the students in this program? This is a very rural Appalachian community, and most of our students come from this community or one that's really similar to it. And most are likely to return to those communities after they graduate and go back into practices there. And so if they get a little glimpse of what clients are going through and the need for low cost or free care just to strengthen the human-animal bond, I think that will help them empathize with their clients in the future and maybe see the bigger picture. They get a chance to get a positive contribution to the community. And while they might not be from here in the Tristate area, for the time that they're in the program, they are a member of this community. And so it does feel good to give back. And we can connect students while they're here in school with some service organizations, particularly like RAM. I'm hoping that what this does is it encourages them to get involved with volunteer organizations in the future and continue to have that spirit of giving back to the community and not just focusing on going to work, getting to the clinic, getting the job done, but really seeing a bigger picture and how what we do as veterinary professionals contributes to One Health and contributes to the local community. So just a quick little glimpse as to what I hope to talk about. And really had hoped to do that 2020 or that June clinic and have some good quotes and surveys from students that participated, but it just didn't happen. So, you know, like veterinarians, we'll just roll with it.
Thank you, Elizabeth.
No problem.
It sounds very interesting. I know I don't remember if I mean, I've probably said it before, but my sister is a vet tech, and her schooling process, I know sometimes she was a little frustrated when she was in school with just how things were going.
Yeah.
I think this volunteer program would be fantastic. Do you think it could be like implemented everywhere, or?
It depends. You know, it's not a one size fits all, and veterinary technology education is wide and varied. And the nice thing about partnering with RAM is that while they're based out of East Tennessee, they really they'll go anywhere. We've actually, for the last couple of years, we've been trying to get together a clinic in the Dakotas on Indian reservations. There has not been a veterinary clinic out there since 1997, and we'd like to do that. Since 2012, I have been the volunteer medical supervisor for RAM for these spay neuter events. With RAM, we don't need to have anyone have local licenses. So if we did go to the Dakotas, I'm licensed in Tennessee. You just have to have proof that you are licensed. So anybody can come volunteer at any time, just so long as they are licensed somewhere. But RAM they're willing to work with whoever needs help, basically.
It sounds really fascinating, bringing it to the reservations.
Yeah.
I mean, let me know if that ever happens. That sounds great.
Yeah, we've been working on it for a couple of years, between communication with the tribal leaders, and we only have small windows of time that we can go because of weather. So if you wait too long in the summer, it's too hot. If you wait too long in the winter, there's, knee-deep snow. So we have to really time it. So we haven't done it yet. We'll see.
Okay, great. We have a question that came through. So Stephanie and Johnny, I don't know which one it is, so I'm just going to read the whole name. Stephanie and Johnny Brown said, we have had a big pushback from our local vets when we've tried to do something like this because they said it takes away from their revenue. Mm-hmm. Of course, we don't want to make them mad because they take our externships. Do other folks have this problem?
No, we don't. In this area, the folks that would come to a RAM clinic are not the folks that would have a relationship with a veterinarian. And like I say, I mentioned earlier, there are a couple of active grants in the area for low cost or free spay and neuter and vaccines, but those individuals have to prove that they live below the poverty level. Most of the people that we see at RAM live just above the poverty level, so they don't qualify for those grants. And so these are individuals that would probably never take their pet to the veterinarian. And some of them have even said, we've had this dog for 7 years and we got her a rabies shot once, but we can't afford to take her anywhere. And that's the same thing for the humans that seek out care through RAM, which is dental and vision and just well checks that are underinsured. They're not necessarily uninsured, but underinsured. So no, we haven't had any pushback from local veterinarians.
Great. Looks like I have one more. Sure. From your experience, what services have offered the students the best learning experience when they're involved?
I would say the triage areas where the students are performing those physical examinations. There's a veterinarian around, and if there's something that they're just not comfortable with, they'll come find a veterinarian. So that's a big area where they really are doing that examination and making some judgment calls. That's a lot of responsibility. And also in anesthesia, we do a total injectable protocol. So we have to have students that are on top of watching those pets very carefully once that injection is administered, and getting them moved over to the surgery area appropriately. And then in recovery, staying on top of their body temperatures, their heart rates, really making the call when they think an animal might need a reversal. So those are probably the three biggest areas.